Hi, welcome to 5 Minute Video Study for the NCE. Today we are in clinical focus and we are in subcategory AD, separation from primary givers. So in this subcategory, we're going to be talking about usually the child, infant, and when they are separated from their caregivers and how to support a family when a caregiver is not in close proximity. So babies and young children may be separated from a caregiver for many reasons. This can include deployment, if they're in the armed forces, or if they have a job that requires travel. It can also include divorce or separations. And it can also include incarcerations. These separations can have a negative impact on the child, the young infant. And in 2018, it is estimated that approximately 2.7 million children had a parent that was incarcerated. So those numbers are significant. And over a million children have been affected by divorce over a several year period. So both incarceration and divorce have a significant impact in this country. And also 2 million American children have a deployed parent between the years 2001 to 2013. So again, those are significant numbers. One of the things that you should keep in mind is that the relationship is very important, especially in the early years. And you all probably have heard of the Dr. Bowlby's attachment theory, and how he did experiments with rhesus monkeys and had, barbed wire versus a fuzzy kind of object that they could kind of cuddle with. So what happens during separation? It's important to understand that there's an increased stress response and anxiety with young children. Many young children and infants do not have the cognitive ability to understand exactly what is happening. So for many of them, it creates difficulties, and that in turn increases the stress levels. It diminishes trust. Separations are difficult to prepare for young children, so a caregiver departure may feel abrupt, right? So that then increases the stress response, which in turn diminishes the stress, the trust. This may lead to a decrease in the child's growth ability to trust these primary relationships. So they may feel like, I can't trust my caregiver because I don't know the next time, that they're not going to be there. And then the dysregulation of emotion and behavior. That is very important. You see that quite a lot in the schools. When a caregiver is deployed, it's not only the babies, toddlers, or older children in the family that are affected, but the other caregivers as well increase the need for support for the whole family system. So this phenomenon is likely to occur in other types of separations as well, making the need for family support in instances of incarcerations or divorce just as important. So, when one caregiver leaves, then it creates a burden on the family unit. What are some of the steps for intervention if this occurs? So again, it's not always possible to prepare, but when there is an option, it is highly recommended that you as a family talk about it. For children who are old enough to understand, typically around 3 years old, it can be helpful to speak in advance about what is happening and how they might feel. Also, make a plan to stay connected. A caregiver who is leaving may want to create some recordings for their children to listen to while they are away, even if it's just for alternate weeks due to shared custody. A child and a caregiver can exchange small touchstones. If possible, they can share photos. So, how can we stay connected with the use of technology, and then follow up with emotional and physical presence. So the remaining caregiver must take time to listen to young children and respond to their emotions. Keep family routines and household management consistent. So, again, because of that change, what they're craving is consistency. And then reunify with intention. So, whether it's a separation for weeks or a separation of years, talk about what that looks like, and then make sure that you're consistent with that. And then finally, promote resiliency. So, change is inevitable, it's going to happen, but, there's different ways of coping. There's healthier ways of coping with it than others. So, understand those resilient factors.